Did you know that there's a connection between chronic pain and osteoporosis? This is Wellness by Design. I'm your host, Jane Hogan, the Wellness Engineer, and my guest today is my good friend, Margie Bissinger. Margie is a physical therapist who got her career start in working with people with chronic pain. She also delved into happiness and the effects that happiness had on her chronic pain patients. Now she's an expert in osteoporosis, and today we talk about the connections between chronic pain and osteoporosis. We delve into the reasons for this connection, the osteoporosis risk factors, and the tests that your doctors are often overlooking. Margie wraps up the episode by revealing the 4 surprising areas you need to focus on to reduce your risk of osteoporosis. I think you're really going to enjoy this conversation. Margie's so happy and fun. So enjoy the episode. I'll see you on the inside. Margie Bissinger, welcome. Welcome. I'm so happy to have you here today.
Oh, it's such a pleasure, Jane, to be with you.
Well, we've been friends for a long time. I love the work that you do. I love the happiness, but I know you're an expert in osteoporosis, often goes with chronic pain. So first of all, like, how did you link that up? I know you said you had like a little bit of a background. This is how you started. It was people with chronic pain and osteoporosis. So let's hear a little bit about that and what got you started in that.
Yeah, well, it was interesting. In terms of chronic pain, I was living in Chicago and I was working. My background is orthopedic physical therapy, and I have a master's in that. And I was working with people with chronic pain, chronic neck, chronic back pain, TMJ. And I had just gone through a bad situation in my life. And they're like, Margie, you're so happy. And I thought to myself, happy? If they only knew what I had gone through, they would just never say that. And then it hit me like, you know, I actually am happy regardless of my situation, regardless of what happened. I actually am happy. And, what is it? What did I do that I can still be happy, even though my circumstances were not so great? And my patients were so miserable. I mean, truly unhappy and complaining, and their pain was so bad, just in this cycle. And I said, you know what? I'm going to start teaching them. I didn't know at the time what it was called, but it was now I call them happiness habits. But I said, I'm going to start teaching them what helped me. And so I did. And all of a sudden, it was miraculous. I have to tell you that people got better so much quicker than with just traditional physical therapy. So that's how I started realizing that this component is so important. And it's something that I've done. This is over 40 years now. This is something that I've done in every program, incorporated this in, because, if you're just saying, oh, poor me, and that's your mindset, you don't heal versus, okay, what can I do? And start being a victor in life instead of a victim. It changes everything. So anyway, so that's how I got into the happiness piece and with the chronic pain. In terms of osteoporosis, then I had moved to New Jersey, and there was a group of doctors, and I was working again, orthopedic physical therapist with therapy, who asked me, could you work with our patients with osteoporosis? And I'm like, sure. And I just couldn't believe. And so they started sending me patients. I couldn't believe what I was seeing. Well-meaning individuals who were trying to help their bones and were doing things that were actually aggravating their bone. They were doing things that were increasing their risk of fracture. So that's when I said, and I had taken several courses, I said, you know what, I have to really help out here because this was breaking my heart. And so that's when I started working statewide with the state of New Jersey. I started working nationally, and that's how I got into the bone health. But there's one of the risk factors for osteoporosis is a sedentary lifestyle or inactivity, people who have inflammation, and a lot of that is with chronic pain. So many, many people in my community do have chronic pain because bone loss is a risk factor in osteoporosis. And, that's how I got into doing things with both communities, actually, or the combination of chronic pain and osteoporosis.
Yeah, and people, a lot of people in my audience anyway, who have chronic pain are also that age that are, the age to get osteoporosis. But what's really interesting, I know you know this, is that osteoporosis, people are getting diagnosed younger and younger ages as well. But so the lack of movement is a problem. But the problem, like, what comes first? Is it that people are in pain and they're not moving, or they're just not moving? And then that increases their risk for osteoarthritis, for osteoporosis, probably osteoarthritis as well, increases the risk for osteoporosis. So what is, like, when you're working with people, what's kind of that first line, the first step that people would do?
Well, the thing with osteoporosis, and people do confuse it, so often, like, what's the difference between osteoarthritis, which is just inflammation of the joints, versus osteoporosis, which is actually, porosis means porous bones. So it's actually a loss, where you're losing both bone density and the integrity of the bone. So it actually changes the microarchitecture of the bone. So it's very, very different in terms of, what the two are. And osteoporosis itself is, for the most part, unless you have a fracture, it's silent. People don't know. So they find out about it when they get a bone density test. And so, or if they've had a fracture, then they do a workup. So in terms of what comes first, we don't know. Yes, if someone has chronic pain and they've been on steroids, for example, that's a huge risk factor to increasing bone loss. So that person should early on get tested. If there's someone who's done chronic pain and immobility, where people are inactive, they've shown that active people have higher bone density than people who are more sedentary. So that's a huge risk factor. And inflammation affects the cells that break down bone. So that in itself, if you have autoimmune issues, which so many people do, and chronic inflammation, that in itself is accelerating bone loss due to inflammation and the breakdown of bone. So there's so many things, and also for everybody, regardless of chronic inflammation, not, hormones during menopause, people do lose bone. So there's so many different pieces to the puzzle, and some of the medications affect. So there's just a lot of different pieces that would go into why someone might be having bone loss. And the unfortunate thing is oftentimes they don't really think about it until down the road. Oh, that's an older person's thing. I'm not going to worry about it. And, they don't get tested until like 65, where the good news, Jane, is that there's so much that can be done. And there's so much that we can control so that we can protect our bones regardless of what's going on. And I think that's the piece that it needs to be put into the forefront so that we can do things now so that we don't suffer later, because there is a lot of suffering with fractures. And, and we certainly don't want to be one of those very awful statistics where, people die. 25%, I think, of people who have a hip fracture die within a year of the hip fracture, and other people never regain their independence. So it's pretty awful, and we don't have to get there. That's the good news.
I love that there's good news.
Yeah,
So
yeah.
so people, with people who have, it's just say they start with chronic pain. So they start with chronic pain. A lot of people then go to medications because, of course, they just want the pain to go away. But then that comes with these risk factors, and we're not thinking that, like you said, it's just kind of down the road. But it is a real risk, and no one wants to lose their mobility. That's how it's our freedom in life, right? Is our mobility. So, all right. So you talked about getting tested. So, if you've got any of the, do we run through all the risk factors? Is there any
I
we
mean,
missed?
there's so many risk factors, but in general, like, I think for this population, for people who have chronic pain, I think if you're on steroids, check with some of your medications. Even antidepressants can increase your risk of, can actually increase your risk of osteoporosis. People who have seizures can increase their risk. The other thing that a lot of people are on, regardless of chronic inflammation or not, and is that they're on the proton pump inhibitors, the Nexium and the Prilosec and all of those, that can significantly, that reduces stomach acid and there's a huge correlation with increased bone density, reduced bone density for people who are on that long term. So, important to look at the medications and especially the steroids. And then, that's something to talk to your primary care, whether it's your physician or, who you're working with, your practitioner.
Mhm.
So yeah, so the medications are a big risk factor, as well as, if you have rheumatoid arthritis, that's a risk factor, in different inflammatory conditions. But should I mention something about the testing? Because
Yeah,
it's not
sure.
all the same. Just a couple things I think are important. Because if you have arthritis, it could mask the testing, like especially in the spine. If you have arthritis, sometimes you get extra bone growth. So it's not, if you get a bone density test, it's going to maybe, oh, great, you have so much extra bone, but it's not. It's because you have extra bone because of the arthritis. It doesn't really mean the bone density, that you have good quality bone. So I always recommend when you get a DEXA, you can get something called, it's abbreviated as TBS, but it's also called trabecular bone score. And you have to hunt for these places, but it's just software that they put over. So some of the DEXA machines have software, and some of the places have software they put over the DEXA. So when they do the image, they have the software that will tell you about the quality of your bone. And that's so important. So because two people with the same density, one could have good quality. If they fall, nothing's going to happen. Their bone is good quality, where someone else could have very poor quality and the bone is, very weak. It makes a big difference. So I would tell anybody, if the doctor orders that, ask, can we get it with the TBS, and just find a facility near you. That's number one. The other thing I think is important for some people, especially if you're noticing a difference, you can get same thing on the DEXA. A lot of places do this. The height. They can do, what is it called? The vertebral fracture assessment, VFA, I think it's called. But anyway, you can look at that. And the third thing I think is just so important, and this is often overlooked by a lot of conventional doctors, I think it's getting more popular, is there's just two tests that I think are so important, especially if you're considering medication or anything. One is called a CTX, and it stands for something, peptide, it's a longer word, but just know CTX. And the CTX is a measure of bone breakdown. So if you have an inflammatory condition, you can see, am I actively losing bone? Is something going on that's breaking my bone down? And then when you do, and there's many things you can do to improve that, you can see even in 3 months an improvement. So I'm a big believer in getting a CTX, and they're not expensive. And it's a blood test. And the other one is P1NP. P1N is Nancy P. And the two of those, that shows bone building cells. So just those two information can change everything. So yeah.
Is that last one also a blood test?
Yes. And they're not expensive tests. And to me, it's not one size fits all. Oh, I have osteoporosis, I'm just going to take a medication. It's not like that at all. It's very individual. And if nothing's breaking down, that changes what you do. But if you see you have massive breakdown of bone, you're going to want to do things to combat that and address that. So I think those two tests, and just something to know, they need to be taken, especially the CTX, first thing in the morning. And, if you look at the lab, they'll tell you can't have any biotin, you can't have any collagen for,
Right.
I think, 48 hours. But anyway, I just wanted to say that because I've seen it gives people so much information to know, is this chronic condition causing bone loss right now? So anyway.
Can,
Yeah.
can most people get those tests with their conventional practice doctor?
Yes. You have to ask your conventional doctor, or any, you can probably order them yourself as well. There's a great book. I love Dr. Keith McCormick. Actually, the book's sitting right here. It's called Great Bones. And so many of my people have brought this to their doctors, if that works. But most doctors will say, well, here's what I found. Because they're not expensive, and some of the doctors will say, oh, that test isn't accurate. But the reason it might not be accurate is because if you do it at different times of the day, it's not going to be accurate. It has to be done first thing in the morning, and make sure that you don't take a few things. So I think it's accurate enough to know, are you losing massive bone? Is it normal? And it really helps. I mean, I can't even tell you how much people in my community have been helped with knowing what's going on. And also, let's say you do choose a medication, and there are people who have chronic pain who've been on, let's say they've been on steroids their whole life or for many, many years and have lost bone. The good news is I'm not opposed to medications. There's new medications that build bone. So you can actually build bone, not to be on this forever, build bone. And but you need to know, is it working? So that's why you would do,
Right.
let's say, the P1MP 3 months later. So you would know if things are, it just gives you so much more information, because the DEXA test, the bone density, you have to wait, a year. They don't do it before a year. So these
Oh,
are just, I found them so, so helpful. And most doctors, so I think people have been able to convince their doctor or then just find another one, but it's not such a crazy test that they would say, oh, but if you just explain, you know what, I just want to see, am I actively losing bone? And what is the balance between the cells that are breaking down bone versus building bone? And so usually most doctors will agree to it. I haven't found that
well, that,
people really have a problem, because it's not, an out there test. It really does give very good information.
that's good to know. And the test that you mentioned, the vertebral test, is that basically like, are you shrinking?
It's an X-ray. It's part of on some. I mean, you can also get an X-ray if you've noticed. They can do an X-ray, but there's something called the vertebral fracture assessment, and I think it's VFA. I may say this wrong. Yeah, I'm pretty sure. But anyway, it's just on the DEXA machine where they do. It's not as good as a regular X-ray, but they do an X-ray to see if there's any compression fractures. You can get an idea.
Okay.
So I think
I
it's
mean, because
VFA. Yeah.
getting shorter, is that associated with osteoporosis?
Sure, absolutely. I can show you, for example, I'm going to show you here for a second. This is a spine. Yeah, I really get the right way. Okay, so this is a spine. This is the front of the spine. This is the back here where you'd feel, like your backbone. And this is cutting in the middle of it. So you see, this is a normal vertebrae. This one up here, nice square. But look here, see this one, like down here? That's someone with a fracture. It's in the front of the spine that we get the fracture, not in the back. So that's why we don't want people bending forward, doing rounding exercises when they have, osteoporosis. But you see now, this is compressed, so it's not as high. So people will lose weight. And that's when you see people, they're more, it's called kyphotic. They're more rounded in the spine. And you also see some other, let's see, like this one here. It's just, it's shrunk. So yes, you will lose more than, you will lose height. So people should always get their height checked. And I think it's very helpful.
I remember that like my mother and I used to be the same height when I was, say, a teenager. And then as she got older, like I was starting to look down on her. So yeah, I mean, it's a real thing. People will kind of joke and think it's a normal part of aging, right? Oh yeah, you just shrink as you get older, but it's not, doesn't have to be normal, right? Common, but not normal.
You lose an inch, you can lose the discs, the discs are in between. So we have the
Yeah.
vertebrae discs, or the cushiony right inside that. And that holds water. As you get older, you don't have as much water. So you will shrink a little bit. But, if you're noticing, I'm not sure, I think an inch or two, if you're starting to notice and really a change in that posture, then regardless, just keep getting your height measured. And I think it's a good idea to get tested so that you have a baseline. Okay, my bones, where are they? And you can just monitor them. You don't always have to do, I mean, I think there's things everybody should do preventatively, because it's sort of, the bones are like a bank. When you're younger, you're building. We get our peak bone, by age 30. But the majority of our bone in women is by the age of 18 and 20, and men, like 85 to 90% of your bone. So what we do when we're younger matters, but at all ages, we could still build and do things so that if you do lose bone when you get older, you have more to draw from. But, a lot of people just don't consider their bones as something important as they do other things.
Mm.
Yeah.
And if it's not hurting them immediately, it's not getting their attention immediately. But now you're saying big connection between people with chronic pain and osteoporosis. So what are some of those, basic things that people can do?
So I think for everybody, I think the basic thing, number one, I think, let's start with, there's numerous things. I think number one, figure out the underlying condition, because it's not, a lot of times people go to the doctor and they're like, okay, you have osteoporosis, go on medication. vitamin D and calcium and goodbye. That's the standard. And if there's, but you need to find out what's going on. So I think working with your doctor and figuring out what might be the underlying root causes. I mean, there's a lot of people that have autoimmune issues in my community from gluten. I've seen numerous people who they ended up getting off the gluten and their bone density gradually increased and their arthritis went away. So you need to figure out the root causes, I think, for everything. And I know you talk about that so much, Jane, because, it is, as I said, it can be very different for many people. So I think, number one, just figure out and get the workup to see what might be some of your root causes. If you have digestive issues and you're not absorbing your nutrients, or someone with anorexia, that's going to be a major factor that you need to deal with. So we can't just forget about that. But in the meantime, everybody can do some type of exercise. That's my biggest thing that I think everybody can be empowered to do. And the research is incredible. The research is so good now on how exercise improves bone density. Is that, yeah. And it's funny, the type of exercise, because a lot of times, people are like, oh, it's just too painful for me, or, that. So it's a negative cycle because they're in pain. They don't exercise because it hurts them. And then not exercising is going to cause more pain because they're not getting the fluids. I always say motion is lotion. So there's this fluid in the joint, the synovial fluid that's stimulated, that keeps the joint healthy, that's stimulated by motion. So they're not moving. So now it's more pain, then the body guards more, and it becomes this really negative cycle. So we need to intervene right away, immediately, even if it's just doing a little bit initially. But I think people can do exercise, but very specific, what increases bone is strength training. What they've really found is strength training and impact. And so, again, if you have painful joints or if it's painful, my best thought, what I think, is to work with a physical therapist. And usually that's covered by insurance, at least in the United States it is. And, so the exercise program is designed specifically for you. I think that's very important so that you can, custom make sure that addressing all your areas. But the other thing that people are afraid of is the strength training. They're afraid, oh my gosh, getting stronger, it's going to hurt my joint. But it's just the opposite, because let's say the person that doesn't do that, and they get weaker and weaker and weaker, and they may be doing some exercises, some mobility, some yoga, but they're not really doing strength training. So the joints are getting weaker. And now what happens, because the muscles aren't protecting the joints, there's so much more force on the joint. So
opposite what people think, eh?
Exactly. And so by strengthening, and I always say, if you have some people just have certain pain all the time. So is it better to have that pain and have a strong joint, or is it better to have that pain and a weak joint? But what happens when you get stronger, the muscles absorb the force and you're less force on the joint. So it usually reduces the joint pain as well. So I think strength training, and that even twice a week, I think, if you can work with a therapist so you can do it, and it's sort of a balance. You don't want to overdo it so you inflame your joint, but you want to do it in a way that you can gradually increase, and it's possible. And so I think that's, my biggest thing is get involved in exercise. One with the strength training. The second thing is balance training. Everybody can do some type of balance training. And the sad thing is most falls happen because most fractures happen because of a fall.
Right.
And so, but we can prevent falls. There's great research on how doing, I love Tai Chi and Qigong. I love, there's many different balance exercises that people can do. And that's one of the gifts I'm giving at the summit, on really showing people some great balance exercises and, showing people some things that they can do. But balance, I tell people, do it every day. Just practice these very simple things so that you improve your balance. Because if you don't use it, you lose it. And then guess what? If you're about to fall, you've practiced these exercises, and it can make all the difference in the world. And the last thing is, there's many things, but to be, in terms of the exercise piece, be mindful. I think distraction, a lot of people fall because they're just thinking about 20 million things at the same time. So, living in the moment, focusing and really not being distracted and just being present can make a big difference. And just basically also nutrition's important,
Mhm.
and making sure what you're eating, nutrition plays a huge role. And then the happiness, stress reduction. To me, those are the components that work in this integrative approach. And people have done great. And look at the bone loss, and maybe like chronic pain even as a blessing in disguise, because they've learned all these great things they can do, that they're empowered, they're stronger, they're able to do more, and they look back and they're like, wow, this made me do this. So yeah.
I found that in my own journey that, yeah, I didn't think it at the time when I was in a lot of pain that it was a blessing, but now I see it that way. And, I've come so far from being barely able to walk to now running, doing trail running and stuff like that. And I know that when I started running, actually my feet got better and better. So they didn't hurt anymore. So yeah, when we can build up the muscles. So I love all that, Margie. Now, for the people listening to the podcast, Margie mentioned my summit, my event. So we're going to talk a little bit more. If you want to hear the rest of our conversation, you can register for the Becoming Pain Free Summit and you can hear the rest. So for now, I'm going to ask Margie, like to finish off the podcast, what would you say is one thing someone could do today that's going to improve their health
I
and
think
begin to initiate healing, whether it's osteoporosis or chronic pain, whatever it is?
I guess I have to say one thing. I would say mindset. I think I would say the most important thing is putting out there and visualizing yourself well and healthy, and just getting that yeah, I can do this, and to really empower yourself with the tools. Find the tools too, but just, I think, putting out the mindset, today, like, wake up, okay, what can be done today? So take the fear and change that into empowerment. And okay, what am I going to do today? What good is here that I'm not seeing, and what, taking one step at a time, and doing and adding some type of exercise, some type of motion throughout the day, I think can make a huge difference.
That's wonderful. Okay, little baby step to do something, just move a little bit today. I love that, Margie. Now, for the people listening to the podcast, tell us where people can find you. Where's the best place to learn a little bit more? And we will have that download for everyone. So we'll have that in the show notes. So check that out. But where can people find you, Margie?
Oh, okay. So best place is my website. So just margiebissinger.com. And my podcast is on that too, but also it's just called Happy Bones, Happy Life. And Jane has come to my podcast and done a great episode. So you can listen to that. But yeah, that's the best place. I'm on Instagram and Facebook, and I have it on YouTube as well under my name, and Happy Bones, Happy Life.
Okay, we'll have all those links there. I love your podcast. You're just so cheerful and fun and really I love how you tie happiness together with all this, because it really is integral to our physical health. People may not realize it, but it really is. And it changes your perception of pain. It can change how your body is actually recreating itself every single day. So you have power. So thank you, Margie, for being a guest on Wellness by Design today, and we'll see you again soon.
Oh, thank you so much, Jane. It's always such a pleasure being with you.